Hello everyone. As you all know, if a tooth is extracted or exfoliated and nothing's been done about it, you know that the ridge will resorb and lose its bone volume, right? So in this case, let's take a look what happened to this particular patient after losing tooth number 9. Just from this 3D rendering, we see that tooth number 9 is missing. And based on this quick 3D rendering view, it looks like the ridge has resorbed quite a bit, not only in terms of the loss of its height, but buccolingual width as well. But let's take a few moments and quantify how much bone has been lost. So let's verify the ridge from this multiplanar reconstruction view. So let's look at this axial. Here's tooth number 8, 9's missing, 10 and 11. And again, it's very, very narrow towards the alveolar crest. And as I go toward the base of the ridge, we see the nasopalatine canal, and the ridge does become a little bit wider as we expect. But again, toward the alveolar crest, very narrow, right? So let's verify that from this cross-sectional view or the sagittal view. Here's tooth number 8, and then see how that ridge changes very dramatically and becomes taller and wider again. Now, let's look at the cross-sectional view, and this is tooth number 8. Let's see how much the loss is, right? So this is the unaffected side. Looks like we've already lost some periodontal bone, as I see that the alveolar crest is more than 1.5 millimeter away from the CJ. That's about just over 3 millimeters. So the patient has lost some bone. And it is possible that in a healthy state, this buccolingual width would have been even thicker than what I'm currently measuring, but I'm getting somewhere around 6 millimeter. Now we slide this cross section over to the edentulous site, and let's see what the measurements are here. Obviously, it depends on where I measure, right? So if I measure towards the crest, it's a lot thinner. But I think it's safe to say it's somewhere around 2 millimeter. So what does that mean? We just went from 6 millimeters to about 2 millimeter. That's a loss of 4 millimeters, right? And in terms of percentage, you've lost about 2/3 of the ridge thickness. It would be nice to know how long this ridge has been resorbing after the extraction. Perhaps there was a trauma. I do not know the history, but you can see from this example that the resorption can be rather dramatic, and I would presume that this would be a little too narrow to receive a typical implant size that we would use on our patient. So likely it would be, I would guess that the provider would be planning for some type of lateral ridge augmentation to put the graft material along the buccal aspect and kind of thicken the ridge a little bit prior to actually placing an implant. Anyway, just wanted to show this with you. I wanted, I want to keep my video short and concise so that you can just learn something new very quickly. Anyway, thank you again, and as always, for tuning in, and I'll see you in the next video. Take care. Bye.